Welcome, and thank you for joining Patient Self-Scheduling, Open Your Digital Front Door. In today's world, providing convenient and safe access for your patients is more important than ever before. And just as important is opening your digital front door. That will help set your patients up for success, and especially set up your practice with the next generation of patients. In this session, you will hear how a women's health clinic enabled patient self-scheduling, seeing more than 3,000 patients schedule online in the first 30 days. And you'll hear how they enabled the online scheduling of virtual video visits and why they switched scheduling vendors. They switched from a third-party vendor to NextGen Patient Self-Scheduling. Let's get started. My name is Cheryl Leibla, and I'm the Vice President of Patient Engagement Solutions. I joined NextGen in 2018 to lead strategic initiatives related to patient engagement. I'm joined here today by Joni Chroman, who's the Chief Operating Officer at SPA Women's Health, and we'll spend some more time giving her more time to give an introduction in a little bit. So what's driving the need for digital engagement? So today we're going to cover what's driving the need for digital engagement. We'll have a client spotlight, which will be about FPA Women's Health experience with patient self-scheduling, opening the digital front door, and virtual visits. We'll hear about their patient self-scheduling strategy and benefits and lessons learned, and how the pandemic impacted their practice and how it may have impacted yours as well. And then we'll have a summary and closing. So let's start with what's driving the need for digital engagement. When we look at the patient engagement drivers, there really are about 5 different patient engagement drivers, starting with the importance of patient acquisition and retention due to intensified competition. Your practice is in competition with many other services, both brick and mortar as well as digital. So a lot of the virtual care vendors that are direct to consumer are competing for your patient's attention, as well as the retail clinics. If you look at what happened with Walmart opening up a primary care clinic within their store. The second patient market driver is patients as payers. Employers, insurance companies, and the government, they're pushing costs and shifting costs to the patient, which that makes the patient a payer and a decision maker in healthcare. So convenience and cost transparency becomes a big part of that story and that interest from that patient's perspective. The digital health and tech utilization has changed how we do care today. I mean, especially during the pandemic and these COVID times, with 81% of Americans owning a smartphone. And that's a smartphone, not a cell phone. It's a computer in their pocket and they can take it with them. And we'll dive into more of those details in the next slide. The pressure to manage chronic conditions and focus on wellness is really crucial and has been for a while. If you look at the stat, 90% of the nation's 3.5 trillion annual healthcare costs are for patients with chronic conditions and or mental conditions. So behavioral health is a big component of that. And that's that 90-10 rule. So 90% is a big chunk of that expense. And then we mentioned the pandemic, we're still in it. This shift towards touchless care and focus on safety, that's new. You know, that made the top 5 this year. And that is because of COVID-19. And if you think about these other dynamics happening alongside COVID-19, some are enablers, technology, and some managing chronic conditions can be negatively impacted by patients not accessing care. So these are drivers for opening the digital front door, but also just patient engagement in general. So who's driving the 81%? You see here technology users are really being driven by the younger generation, so millennials and the Gen Xers. But the baby boomers are also heavy adopters. They've had an increase since 2011 in volume. They're just not as high of a percentage as the millennials, which are in the 93% in Gen X and then 90%. And you see here both the smartphone and the tablet computer. So why is this even important? Yes, they are making up 81%. Yes, the trend is going up. But why is this important for you? It really is because this group, the baby boomers and the millennials, are the two largest populations in the US. So just like the baby boomers, the millennials are making a difference in society. And here, the Accenture quote is that they're coming into their own by 2020. We're in 2020 now, and they are projecting that they will spend about 30% of the total retail sales and grow to 1.4 trillion annually, and that's purchasing power. So you can imagine their influence on healthcare. So you may have heard of femtech or she economy. The reason for this industry focus is because women play an influential role both as a consumer of healthcare and a decision maker. So you see here, women are better consumers of digital health solutions than men. They are 75% more likely to use a digital tool for healthcare than men. They are using digital tools. They are 29%, they spend 29% more per capita on healthcare compared to males, so they spend more, but they also control the decision making. That 80% of the household healthcare spending is done by women. So similar to preparing your practice for the millennials, women is a segment of the population that you also need to pay attention to when you're thinking about opening your digital front door and patient engagement. So now I'd like to invite Joni Chroman to tell a little bit about herself and her organization. And Joni, thanks for joining today.
My name is Joni Chroman, and I'm the Chief Operating Officer for FPA Women's Health. My background is in primary care, women's health, dental, patient access operations, and contact center operations. So, and I've always worked with underserved populations. So my focus is always how do we get patients to get the best possible care at the right time in the right setting. And so that was a natural fit for telehealth, virtual care, and also online self-scheduling, which we'll be talking about today. I came to FPA Women's Health almost 2 years ago in February of 2019. And I came with two strategic initiatives, two important things that I wanted to roll out. One was telehealth and one was behavioral health. And FPA has always been really interested and focused in meeting patients where they are. And with these initiatives, I thought that we could really help bring us into the new era of digital engagement, which you talked about, Cheryl. FPA Women's Health is one of the largest independent and privately held family planning and women's health organizations in the country. In California, we operate 25 practice locations all the way from Sacramento in the north down to San Diego. We operate with more than 40 clinicians, some OBGYNs, and many nurse practitioners and physician assistants. And our patient demographic is exactly what you were talking about, Cheryl. It's women of reproductive age between the ages of 18 and 35 are about 80% of our patients. We see 150,000 women a year, and right now about 8.5% of those visits are virtual via telehealth. This was a perfect opportunity for us to engage with our patients exactly where they are in the digital realm.
Well, Joni, the demographics of the patients you serve are perfect for a digital solution. What solutions did you implement?
They are absolutely perfect, and our patients are online most of the time. They are digitally engaged with each other and with the vendors that they use. So we implemented virtual visits in December of 2019. We've seen over 6,500 telehealth visits since that time, about 1,100 visits per month. and growing all the time. We also deployed patient self-scheduling in June of 2020. And in the first 30 days, we saw over 3,000 appointments scheduled online via the PSS tool. And we were very, very happy with the seamless success of the technology. On a monthly basis, we schedule about 5,500 visits, and that's growing all the time. And so we're really happy with the way that our new technology is helping us engage with our patients where they are.
So now we're going to turn to patient self-scheduling strategy and benefits. We'll look at it from both a market perspective, and then we'll ask Joni to give her organizational perspective on their strategy and the benefits they achieve. So starting with the market perspective and the need to enable online patient self-scheduling. Missed appointments remain a problem in the U.S., and it's to the cost of $150 billion related costs associated with missed appointments in the U.S. Why are patients missing appointments? You see here on the chart, more than half, it's just because they forgot to attend or cancel the appointment. But things like online scheduling and appointment reminders can help address that. In addition, almost 30% incorrectly noted the appointment time. Again, if you have that confirmation and you have that reminder, you'll have the correct time and date of the appointment. And there's other issues related to work conflicts, etc. Now with virtual care, that can also help to alleviate some of those pressures so that you don't have to worry about traffic conditions, weather, inclement weather, etc., to have your visit and receive your care. So what is the solution? It's really opening your digital front door. And your patients will thank you for it and have a positive perspective, as some of these stats show that almost 90% of patients appreciate being able to schedule, change, or cancel appointments online. And 77% of consumers have a positive perception of companies that send them text reminders. So opening your digital front door not only helps reduce no-shows, but it gives your patients a positive view of your organization.
So Joni, I know when you mentioned about implementing your solution and you mentioned that you switched vendors. Why don't you tell us a little bit about your strategy and why you switched vendors?
Happy to. We had used another vendor for self-scheduling online for about 3 years, and it was moderately successful for us, and we thought it was working fine. But there were times when defects were present. The technology clearly wasn't working. Patients would come in and say, hey, I had an online schedule confirmation from you, and yet we couldn't find the visit in EPM. Or patients tried to cancel a visit and we weren't able to take it off of our schedule and free up that access for another visit. So these defects, as I call them, happened on a daily basis, on a regular basis. We don't even know how many visits were not actually successfully able to be scheduled because of the lack of integration with EPM. And we know that our program became much more successful as soon as we turned on NextGen Patient Self-Scheduling, because we immediately shot up around 800 visits just in the very first month. We know that there were technology issues. We just couldn't solve them, so we didn't know exactly what they were. But as soon as we turned it on, we saw improvement. The other thing that we liked about patient self-scheduling was we, as the provider, have all the control about our scheduling. So we don't have to go into a different system in order to modify or sync up a different schedule. We build our provider templates exactly as we normally would. We use the same categories. We use the same event types. It's all built in NextGen the way that we normally use practice management. And that availability is automatically visible to patients via the self-scheduling tool online. So you don't have to make any changes in a different system. It's all made within NextGen. The other thing that's really important is when we integrated it with our virtual visit or our telehealth tool, we were able to make our telehealth visits available to patients across the state the soonest available appointment was visible to them regardless of their location. And so with our previous vendor, if it was a patient who was looking in the Sacramento, just happened to be looking in the Sacramento location, they would actually only see availability for telehealth in the closest telehealth location or the Sacramento location, which if you think about it is useless, because that's why you have telehealth anyway. That's why you use telehealth, is to make visits available to patients across the state regardless of location. That's the whole benefit of it. So being able to, so a patient now can use the self-scheduling tool, select telehealth as a visit reason, and automatically see the soonest available appointment, regardless of which location it's in. So that was very, very important to the workflow. And it made it, you always want to get to the quickest way and the easiest way for patients to get from A to B. You don't want to set up any kind of barriers to access at all. And so you want to make sure that your scheduling templates internally within EPM are supporting that access and making it easy for patients to schedule.
Thank you, Joni. I mean, that's probably a great segue to talk about how the benefits of patient self-scheduling for both your practice and patients.
Yes, so we have a lot of great data for the patient satisfaction for patients who meet us virtually via telehealth. Over 95% of patients who meet our providers virtually give them a rating of 9 or 10, a top box score, which is amazing. Those of you who deal with patient satisfaction on a regular basis know how strong that number is. 95% are happy with that visit. So you just can't do any better than that. Our net promoter score, or likelihood to recommend, is 84, which of course is a stellar number. We're very, very proud of how patients are viewing our telehealth and self-scheduling platforms. They find our services easy to access and meeting our providers a positive experience. So that's always great. The other benefits that we see for patients is they have secure communication with their provider in their own time. They feel safe at home. Even during the pandemic, they can schedule at any time, and they can cancel at any time, and they don't have to engage with a staff member. So that's efficient from a staff perspective as well. Along the lines of efficiency, providers now can utilize any extra supply they may have. Let's say a provider has a schedule in the morning open for in-clinic services, and they're very, very light in the afternoon. We can very, very easily open up a telehealth template for that provider in the afternoon, and all of a sudden that provider has a filled schedule, and which is just fabulous. It's fabulous for efficiency. Providers are happy, patients are happy, and from a cost perspective, it's very successful for us as well.
That's great, Joni. I'm sure you've had some lessons learned along the way. So would you please let us know what did you learn?
Absolutely. I'd love to share with the NextGen users that the technology is the easy part. Setting up the technology is seamless. Having a good representative on the NextGen side and having a positive relationship where you can communicate regularly, that's very, very important and really critical to success. Having an integrated solution, the technology is great, but not in a vacuum. The technology has to work within your digital platform and within your technology platform. The plumbing has to work, or you're going to have defects that you don't even know how much they're affecting you negatively, because things just don't work the way they should. So until you have an integrated solution, you don't even know what you're missing out on. The other lesson I'd like to share is internal workflows, or the internal setup of your schedules, is just as or more important than the technology itself. So my background is in patient access. So I'm a big supporter of open access. Any kind of carve-outs that you might have in your provider schedule, carve-outs for, I'll only do one type of visit at this time at the top of the hour, or procedures at the bottom of the hour, or an initial visit 4 times a day, or those kinds of carve-outs. The more you have them, and sometimes they are necessary, but the more you have those carve-outs, the more barriers to access that your patients are going to experience when they're scheduling. And again, if you want a successful scheduling program, you want to eliminate those barriers and get your patients the fastest and easiest way from A to B, from scheduling that visit. More internal workflows. Make sure that when you're implementing virtual visits, that your staff know to make sure the details are populated in practice management so the provider knows what the visit reason is for. Make sure your staff are scrubbing the schedules so that the lab results are ready for the provider before the patient comes. Make sure that pharmacy information is entered into the visit to fully enable e-prescribe and make sure that that patients can access their prescription when they get to the pharmacy. Those kinds of internal workflows are critical to success. And if you're not having a successful program, or if patients aren't happy or providers aren't happy, it's likely because you have internal workflows that need some process improvement and some discussion. Create internal and partner feedback loop. I never implement a new program without really setting up time to listen to my providers and listen to my staff and listen to the challenges that they're having. If you are not listening to your providers and resolving their concerns, then you can't build a successful program. So listening to your providers, they're the ones on the front lines and experiencing the tools. If you're not listening to your providers and staff, then you're missing out on important opportunities to optimize your technology. Communication for system optimization. Your teams know how to make those tools successful. Your teams are the ones who walk through the process every day. So ask them what their best practices are. Set up forums to allow them to share their best practices amongst their peers. Make it a culture where people are allowed to escalate feedback and tell you when something is not quite working. That's really the best way to optimize your technology and provide a great patient experience.
How has the pandemic impacted your practice? I know you had a lot of tools already in place, so it would be great to hear your perspective.
So the most important thing about our response to our patients during the pandemic was keep patients safe. Help patients feel safe and also access care. And so that's something that we were very, very lucky. We felt very privileged that we already had a telehealth platform up and running and ready to go during the pandemic. It was a very uncertain time. It wasn't that long ago, but if you just think back to March or April, how frightening it was. It was a really, really frightening and scary time. And a lot of providers had closed their doors. A lot of providers just weren't able to stay open at all. And that means that patients couldn't access care. And so we felt very lucky that we could get up and running via telehealth 6 days a week within 1 week of the lockdown starting. We had providers on the phones from online between 8 and 5, 6 days a week. And so we were ready to go. It was patient-centered. We made ourselves available, and we were able to see patients where they are and still have them safe at home, which was the perfect option for them. We were able to increase our provider supply. So when we had some providers who are online, but the providers who were actually still continuing to see patients in clinics, with of course our increased safety guidelines and PPE and screening patients before they went back to make sure that they weren't experiencing any respiratory symptoms, making sure that family members stayed outside and nobody was able to come in. All those guidelines were really important to keep our in-staff, our in-clinic staff safe and feel confident in delivering care. And so because we were able to put some providers on online, we were able to keep that access open for the patients that we absolutely had to see in clinic. So it really, really helped us keep our doors open for the in-person visits that had to happen. You know, some things you just can't do over the phone. Also, during the pandemic, there were many, as you know, relaxed regulatory guidelines for telehealth and also for enrollment in certain state programs. And that really helped us a lot, because when patients were unable to actually come in to access care, we were able to enroll them via telehealth and get them ready, do all of the administrative work at home where they felt safe, where providers and staff felt safe, and then would come in to get their IUD, let's say, and only come in for their actual procedure that they absolutely needed. But all of the enrollment and administrative work was done from home. So all of those things really helped us meet patients where they are and keep patients feeling safe during the pandemic.
I want to give you an opportunity to let us know if there's anything else you want to say about how the pandemic impacted your practice, you know, what any successes, et cetera.
Sure. Well, our successes were obviously we're able to preserve patient volume and revenue during the pandemic using online self-scheduling and telehealth. So those things are, of course, critical to keeping your doors open. We were able to reduce the number of duplicate charts. So as you know, having duplicate charts in your system is a significant patient safety risk. And so by changing to a new vendor that was fully integrated, we were able to reduce the incidence of duplicate charts and reduce patient safety risk. So we were very happy with that outcome. Challenges still remain with insurance benefits, especially across state lines. And so I think our policymakers in Sacramento and in Washington and our insurance companies really need to work together in order to streamline and create policies and guidelines that support patient access and care in the telehealth and the digital environment, because it doesn't matter where you are. If there is a provider in California that can help a patient in Texas, then we should be able to support that. But our insurance guidelines are barriers at this time. So that's definitely a challenge and will continue to be until it's addressed on a policy level. As far as opportunities are concerned, we are very excited to implement new patients to our telehealth workflow. Up till now, we only see existing patients via telehealth, but we are working with NextGen to be able to see new patients very, very soon. And so we're excited about expanding that opportunity for access to beyond our four walls and beyond even the communities that we serve now. So we're very excited about seeing new patients. Lessons learned, I will say it again, integration, integration, integration. Make sure that your practice management system and your EMR are able to integrate successfully with whatever vendors you choose. Make sure that that plumbing is working, because those barriers are going to be inhibit your success with both providers and with patients.
Thank you, Joni. I mean, thank you for telling your story from the pandemic to your lessons learned to what benefits you experienced. Let's go back to the beginning for a moment, and maybe you can summarize it for our audience. You know, what are the key takeaways?
These are my key takeaways. Meet your patients where they are. And if your population is one that is ripe for digital engagement, then make sure that you have the technology to do so. FPA has always been engaged in meeting patients where they are, and telehealth and patient self-scheduling are critical tools to be able to do that. Make sure that you're not just focusing on the technology, but you're also focusing on your internal workflows. Make sure that your templates are open and accessible. Make sure there are not too many barriers, too many carve-outs that make it difficult for the system or the patient to find an open slot. You want to make it the easiest and fastest way from A to B, from a patient wanting to schedule to being able to schedule. Process design and staff training is absolutely critical. Make sure that your staff are entering pharmacy information, entering details into the visit that make the provider, make it easier for the provider to deliver great care. Make sure that the lab results are in before the provider gets online in order to deliver lab results. All of those things are very, very important to make it a successful telehealth day. Integration is key. We talked a lot about that. Make sure that your technology is working and that the plumbing between your multiple technologies is working. And then again, it's important to have a great relationship with your vendor, and it's easier to do that when you have one vendor who's managing multiple functions or multiple technologies. So make sure that you have great management and technical support on the vendor side, and make sure that there's great communication so that you can resolve incidents as they happen. And all those things will help you deliver a great patient experience.
So thank you for sharing your story, Joni. We learned a lot with your key takeaways and the summary of what you've learned and your successes.